Hey, welcome to Fire Engineering's Humpday Hangout, to our show, the issues and challenges in today's fire service. And boy, do we have some issues and challenges going on right now. I'm Chief Rick Lasky, along with my bud and Humpday Hangout co-host, Lewisville Assistant Chief Terry McGrath. And we've got a
Chief.
great one lined up for you today with another great group. As a reminder, we say this every show. Um, if you have any questions, head over to Twitter and send them our way. We're all watching. I do my best while our guests are visiting, and just make sure you add hashtag FE Talk for Fire Engineering Talk. Today, our topic, and Terry and I went with the title of, and actually we borrowed it from one of my mentors from a long time ago. That during times of crisis, it's always about leadership and discipline. Um, and whether it was 9/11 or any of these other things, these challenges we had, whether it's a mayday or just something that's going through your department in the way of a tragedy or a difficult situation, it's always about leadership and discipline. And then the subhead with was, what are you doing during all this right now? To introduce our guests, and I'll run through their names real quick. And we've got Dr. Stuart Coffman. Dr. Coffman is the medical director for Lewisville, as for other departments. And I I use this word very rarely, but I adore him. I adore Dr. Coffman. He's one of the best project medical directors I've ever been around in my career. We've got Chief Scott Thompson from the county. Scott's been on this show a ton of times with us. We've got Division Chief Michael Spinuzzi. Scott, obviously from the county. Michael's from Lewisville. He's the EMS chief there. And we have Chief Bobby Halton. All right, we got the boss with us, and obviously, like I said, my partner Terry McGrath. But welcome, guys.
Good afternoon.
Hey, Chief.
Hey, Bobby, let's do something real quick here. You know, you know, when I saw the post, we were actually teaching in Louisiana, and we saw the post about FDIC being postponed. And first of all, to anybody that would post anything negative about that, I'm just gonna, you're a Nimrod. So let's just get that out of the way. But Bobby, I mean, it would have been very difficult. In fact, the governor kind of put the kibosh to it, but to bring 36,000 people together for the week at a time like this, I know that was I guess I won't say it was a difficult decision. I know it hurt your heart because, I know what you mean to the fire service and what FDIC does. But I mean, you and I were on the phone and you said, well, I'm kind of taking credit for what the governor, I mean, it was something that had to be done, right?
Yeah, it was unavoidable, in light of the way it eventually completely played out with the state of Indiana is basically shut down, as is the rest of America. And so, with all the preparation and all of the other things that go on, and irrespective of what the crisis of the virus does, and all of that is unfolding day by day, as Dr. Coffman will be able to speak to in a few moments, we don't know what the trajectory of this is going to be. And so I think everything that's being done at this point is measured and correct. And it's fascinating. Is it tough? Absolutely. And we have to remember that, as firefighters, our jobs are sustained. We're a necessary part of the social fabric right now, and we're critical. But millions of our fellow citizens right now are losing their jobs, and FDIC supported a great many people who, we'll never know. Shopkeepers, restaurant workers, everything, the hotels. And so the decision was a prudent one. It's right in line with what the rest of the nation is doing. And I know that we're hearing from a lot of folks that, oh, this is an irrational response. Well, I would disagree. I'm a big fan of Nassim Taleb, and he points out that mankind's irrational responses to things have pretty much kept us alive for about 10,000 years. So I'll go with irrational every time, and the abundance of caution. Now, does that mean that it's going to be pain-free? No, absolutely not. The fire service, all of America, all the world is going to have to rebuild, readjust, reassess in the wake of this event. But that being said, I think that, and Dr. Coffman will talk more about the disease and such in a moment, but there's a couple of things that I'm very proud and about the fire service. And I think we need to remember that we represent the very best in our communities. We have to be somewhat, not stoic, well, stoic in a way, but empathetic always. And we need to be that example of who we are. This is a time when our caliber and our character is going to be tested. And I know that the American Fire Service will set a way and set a standard for the rest of the American culture to follow. We're going to weather this. We're going to do everything we can, and we're going to come out of it stronger, smarter, and more prepared for these events, which are going to occur in the future. We have a global economy, and we're always going to have international travel. So this is not going to be the last medical pandemic that we face. And so we're going to learn a lot. And we have a lot to share among everybody. But on behalf of FDIC, we learned a lot, and we're continuing to learn a lot. We looked at a lot of protocols, which are going to be enhanced because of this, in terms of regulator cleaning and face piece cleaning and just everything. And so I'm very proud of the way that FDIC and fire engineering and GEMS and have handled this so far. We actually had a confirmed case at our EMS Today conference, and we followed all of the recommended state and federal and local guidelines as to how to deal with that. And so on behalf of all of us, we apologize for the imposition and the postponement and any problems that may have affected your organization or yourself in terms of scheduling and all that, et cetera. But I don't think we're the only ones who have asked for your understanding at this time. But the only thing that I will say is that we're here, and if you need help as part of the American Fire Service, Fire Engineering, Firefighter Nation, Journal of American Services, Fire Apparatus Emergency Equipment Today, if you need anything from us, please don't hesitate to ask. If you need something sent out, if you need something shared, we are here, and we work for you. We work for the American Fire Service. We always have, and we always will, and we're committed and devoted lots of interest to you. And so, irrespective of what others might tell you, our doors are open. You're welcome here. Any concern or need you have, get it to us. If we can't help you, we'll help you find someone who can help you.
Well, and Bobby, I went. You and I talked about this the other day, and I posted, a bunch of links yesterday. Like, you shouldn't have to, but just to throw it out there to go look. There's plenty of things to be doing now, training wise. There's plenty of resources that you can go to on the internet. If you just look at all the different sites that you have with this, you could spend the rest of your lifetime going through them, and you'll never get through all the videos and all the PowerPoints and all the blogs and all the radio shows and shows like this. So there's plenty out there for people to do. But like you said, as a resource, an invaluable resource, it's huge. And I think a lot of people tend to forget that when we're going through this stuff right now.
And I would say, Chief, that the number one thing, Ricky, to keep in mind is that now is the time that we fulfill our primary purpose. We exist for these communities. I don't care how large or how small. I don't care if it's one individual who just is freaking out. We pay attention, we care, and we take care of them. And we're going to do that. And when this is all over, and I know a lot of, to quote Winston Churchill, it will probably be our finest hour. And to all of the knuckleheads who said things about Generation Z and the millennials, well, watch. They are going to step up to the plate. They are going to blow you away. And they are, as every subsequent generation of Americans has been, the greatest generation.
Well, and exactly. And Dr. Coffman, before we get to Michael and Scott with what Lewisville and the Colony are doing as role models for so many in the way of their response to this, from your end, it's not obviously not just being the project medical director for so many different places, but a lot of people were playing this down like we do. We tend to joke, and you see all the memes and all this stuff on social media, but like we were talking about before we went live, I was talking with one of my best friends in Washington State, and they're right there, where the nursing home is, and where they've had, so many there. I think they're up to 40 fatalities, but there's a lot of myths, and there's a lot of, as there is a lot of speculation in that. And I guess my first question is to you is if you can give us an update from your end, as to what you're seeing, and then maybe we could talk about what we should be doing as, again, to our audience as paramedics, EMTs, firefighters, first responders. What your thoughts are.
Sure. So, hey, Chief, thank you again for the opportunity and the invitation to participate. The response really is overwhelming from both on the pre-hospital and the hospital side. I think what we're seeing right now at this juncture, today, we're seeing the tip of the iceberg in terms of the cases. The testing, the issues we're having with the testing platforms, and just really the quantity, the ability to do broad-based testing has hampered our ability to know exactly how far this has penetrated into the population. And the test that we have now is what's called a PCR, polymerase chain reaction test, which is good for diagnostics, but it's not great for screening. And so really you have to wait till patients are symptomatic before it really becomes helpful. And we just don't know how many in our population are already infected. That being said, I think the social distancing that's been advocated is really, really critical. And the reason, and the number, you'll hear President Trump say 10, CDC say 50, a governor may say another number. It's not so much the number of people around you, it's the space in between those people. And so the space, because it's a respiratory droplet phenomenon, it's that spacing that's so critical. So for our EMS, for our medics in the field, trying not to get within that 6 feet distance to a patient until you kind of confirm whether or not they're at risk for it or not, it's really critical. It keeps the exposures down. In the hospital setting, we use scribes, we use other folks. We're having those non-essential people stay back from the patients just to avoid even the possibility of contamination and infection. And so I say that only to let's not make sure we don't downplay that social distancing. It is critical right now. That being said, there's a window of time when that's effective. It's effective now. It won't always be effective once we get to another stage of the response when a larger portion of our population is truly infected.
Well, and back to the numbers thing, everything I've read, and I was pretty proud. I watched the press conference yesterday. The doctors that got up to speak were incredible. Like you know how much admiration I have for you and what you do. It was incredible to hear. It wasn't a bunch of some people get up here sometimes and they look almost like they're guessing. They were good. They were down with the facts, and talking about the fact that so many people, the younger folks, can be carrying it, not even know, and still be spreading it, and that even the symptoms may not appear for like up to 2 to 14 days. That again, the social distancing is huge. Some of the guys I was talking to, it's like just like you said. If you're at all suspicious, they're one EMT, one medic is actually doing the treatment, and they're doing all their protection, masking up the patient and then themselves, and then non-essential folks are not there or out, and the rest are the further than 6 feet. And it's simple things like that that I shouldn't say maybe simple, but having that tenacity to stay within that format is going to help your department, because so many people forget, doctor. We're doing some classes, and I'm like, we go somewhere and just talk about getting 50 firefighters together from 10 different departments, and somebody tests positive. Now you have fire chiefs worried about quarantine. We're shutting whole places down, and some of these, a lot of the fire departments are running 1, 2, and 3 stations, and they can't afford to shut our whole shifts or whatever. So I think the social distancing is huge.
And you're right about the danger to our workforce. So we currently have 5 providers that are in self-quarantine because of exposure. The problem, not only are sometimes the symptoms delayed, but they can be subtle and they can be asymptomatic. We've had a couple of patients picked up because they had abdominal pain, and the CAT scan wound up catching the bibasilar pneumonias on the CAT scan. We never would have known it.
Oh.
We wound up having to quarantine a couple providers because they had no clue. They had no idea that this could have been a COVID patient. So we're seeing some quarantine situations. because it is so difficult to tell early on if the patient is symptomatic or has those risk factors. And the reality is that now that we're having community spread, the geographic and contact questions that were so important, 2 weeks ago, really have no basis. So we're to the point where there's no way to know if you've had contact with a positive patient, and the geographic locations just don't matter anymore, unless they're positive. Obviously, if somebody told you, yeah, I just traveled from Washington, from Seattle, Washington, you're obviously going to take that very seriously. But the fact that they didn't travel from Seattle, Washington, really has no impact on whether or not they might have COVID.
So probably the most important message here, and I was going to get to grab Scott here in a second, is, don't play this down just because in your area or your age group or you don't see anybody. I think it's hard for people to readjust their lives. It is to like, okay, like you need to stay home. If you don't have to go anywhere, don't go anywhere. And I've seen some great posts lately about here's things to do with your kids, here's stuff to do with this, how to keep things kind of vibrant at home instead of everybody going out and making unnecessary trips to it's like, how many unnecessary exposures can I put myself at? Let's be smart about this. Scott, in the colony, again, the colony is one of the most proactive fire departments in the country, one of the most, whether that's training or just how you guys provide your service. And a lot of that has, you'll always give credit to your people, and that's what good bosses do. But what's the colony doing, in the midst of all this with your people? What are the orders right now, and some of the procedures, and then we'll jump maybe to Michael next and talk about Lewisville.
Well, the first thing, it was a management aspect. I have my EMS chief working on the now to 15 days. The ops chief is looking from 15 to 45 days, and I'm looking kind of beyond that. And that's how we broke things up. We were fortunate, and it's because of our EMS chief. He asked for supplies almost immediately. So we were able to get the equipment that we got. Now, operationally, not only are we separating ourselves from the community, we're limiting visitors to the firehouse and all those things, but we're keeping our company separated. So we're not having rescue go over and visit the guys, and everybody's staying in their house separated. And then we're doing what everybody's probably going to say. We're limiting the number of people that go in. We did develop a throw bag where once we get in line of vision where the patient or a family member, we throw them a kit that has masks and gloves in them so they can put that on. And then we limit the number of people that are going in there, of course, working very closely with our medical control, looking at some pretty strict decom procedures. And then just really, like say, that social separation, keeping all our crew separated. We're prepared. We weren't able to dedicate one crew to do just that because we wanted to have a firehouse to quarantine or isolate people. And if we had to, we couldn't lose two firehouses.
Right.
So right now, everybody's making calls. The ambulances, the medic crews are going in first. So that's kind of what we're doing. We're meeting twice a day. We're meeting at 8 o'clock and 5 o'clock with updates. A big part of this is still gaining information. We're tracking very closely what's going on in Texas and in Denton County. And then, of course, in the colony. And I spend a lot of time doing that. And then we're tracking our members to make sure, where they've been, where they're going, because we could lose a third of our workforce, a shift really quick. And then we got some real problems. So that's kind of the things we're focusing on.
Well, and the jump kit, that makes sense. You and I were talking about that earlier, that there were other places where we had to have that just to go in, kind of like what my son would do in Afghanistan as a corpsman, with the, attaching the Marines. He's got only so much on him and around him, and then being able to, do what you got to do and then get out to where you can actually start to perform some treatment, things like that.
Yep.
And again, go ahead.
Oh, sorry.
Terry.
No, I was just going to say, kind of going in line with what the title to the show, Chief, but, what the one thing, I guess, when you look back at 9/11, everyone had a visual sense. I mean, there was something tactile to what happened because you could see it, the impact, the significance of it. So the subsequent response, and I think within the general public, within the fire community itself, because there was something with this, I think it's been a challenge just to, I think from Dr. Coffman's end, right, and epidemiology, they know what this means, and they know the significance of it. But until it, hits in your own backyard, I think one of the true challenges within the last couple of weeks is getting everyone to understand, hey, no, this is real. The social separation, right? Because we've all heard it. The community comes out and says, hey, we're going to shut your restaurants down. And everybody's like, whoa, this is crap. I can't, I was going to go to Chili's tonight, whatever. No, this is real. It's significant. And when you apply this thing to what the healthcare community is trying to get everybody to understand, I went a long way just to get at a point where, when Scott makes the statements he makes, and he makes it with a lot of conviction, but I think you got to be up front and you got to be out front. And that is with our people, and to be in touch with them almost daily to say, this is what's happening. This is what we are doing. We don't want people drifting on this. We don't want our own people drifting. Everyone has to be steadfast and absolutely committed to the processes that we're putting in place. And it's getting that buy-in and getting everyone to understand, because I just make this statement, this is a marathon right here. And we are at the very beginning of this thing.
Exactly. And again, the point you made very clearly about what Scott said, it's staying in touch with your people, keeping the troops informed. The worst thing you do is just, kind of, it's almost like sometimes we abandon them. We just kind of all right, you're out there firehouse, and they're like anyone else. They've got families, they've got people, they're thinking, they're worried about themselves. Every call they run on, they're wondering about themselves, and so on and so forth. So again, in the absence of good bosses that are out there, Bobby was one of those too, that was always out with the troops, always out with the people. He wasn't a desk commander. He was, in fact, probably one of his downfalls was falling behind in paperwork and all that, because he spent a ton of times with the troop, because he was one of those bosses that did just that. Michael, what's and I know a lot of similarities probably with the colony, but Lewisville, what are you doing with your guys? The EMS chief in Lewisville, you guys, again, another department runs the wheels off your ambulances, EMS wise. What for the Lewisville then? What's going on, buddy?
So I think we took a very pragmatic approach several days ago, where we dedicated one fire station and one ambulance to COVID-19 patients only. So when we have dispatch going through the questions, or that initial response engine that gets there, and those questions match up with, hey, this patient might be a COVID positive patient, everybody's out of the room. So first off, we limit the amount of people that go in. I've told these guys that these are not critical calls. This is a slow roll it. Walk up, get your information, make sure you know what you're getting into. Social distance, we can talk to patients 6 feet away. And if that time you're like, hey, this is a questionable call, you give the patient a mask, you put your mask on, and we start our assessment from that point, and we get the COVID medic in process. The other thing that we're able to do is with my EMS captains, that gives me an extra set of eyes on scene. So when the COVID medic is dispatched, our EMS captains are dispatched, and it almost becomes a command structure at that point, where I've got the EMS captain who is well-versed in all the changes that are going on. As you know, they happen hourly. These guys are up to date. The communication part of this has been insane for me. I've always been really good at communicating with the guys, but half the time, by the time I visit one station and get to the next station, it's already changed. So I'm having trouble with that. I keep my EMS captains up to date. So now they're on scene. They're able to answer the questions. They're able to oversee the guys putting the PPE on. They're able to answer the questions the hospitals are given. They're able to all the way through to deconning the people. I have one person and one set of eyes on this patient and our crews. By putting the COVID medic into process, I think it did several things. Number one, minimizes the number of guys that we have exposed. So now I have one guy getting suited up, maybe two if they need to put the person on a stretcher. It minimizes our use of PPE. So everybody's right now pretty much got the PPE we're going to get for quite some time. So now I've only got 2 guys putting on gowns and going into a house instead of 5 or 6 guys putting on gowns. I think that's going to help us manage our PPE until the restock starts to happen here in a couple of weeks. But it's definitely a challenge.
Well, those are great ideas, Michael. Let me throw a question at you. And again, I'm kind of partial because of my 12 years of Lewisville, and I know just how special everybody is there, and it's an incredible fire department. So you tell me, Lasky and McGrath, we're gonna be on that ambulance, the one that's taken the priority on those calls. And it's just a thought. It's just a weird thought. I don't know if anybody. I know some guys that would probably say, Chief Spinuzzi, sign me up, put me on there. I don't want him going because he's going to go home tomorrow. He's got little kids. Look, my kids are all out of the house. Whatever. Has anybody stepped up and said, just put me on it? Or, has there been consideration there? Because I know that's a question.
Absolutely. All 3 shifts guys stepped up and said, I'll do this. So we've got committed guys who are in this for the duration. They said, I'll take it for 6 weeks, 8 weeks, whatever it is, I'm in this. So it was helpful instead of just telling 2 guys, hey, this is your job today. The 6 that we have assigned to it all stepped up and said, I'm ready for this commitment.
Yeah, and Chief, and to speak to Bobby's point, when he kind of opened this thing up, this is what we signed on to do. And if there are people out there in this business that are like, oh, hey, like whatever, Chief, you've used the analogy, the guy that went to work at UPS and he's pissed off because there's a bunch of boxes to move around. This is what you signed up to do. And so, I think it's it's important. I think station officers need to remind. I just visited with Matthew Morrow about 30 minutes before we came on air. Matthew just started at this department a couple of months ago. He just got off of his training. He's riding an ambulance today. I don't know, he's 20 years old, 21 years old. You know what? He's got a smile from ear to ear. And I just said, Matthew, it's interesting now, right? This is this what you thought when you graduated from school a few months ago? And, he can't even respond to me because he's smiling and this is right where he wants to be. And I told him, and I said, listen, this is unusual. I'm not saying we won't see this again or you won't see this again in your career, but in 30 something years of public safety for me, these are unusual times. But the captains in the guys in the stations, they need to be out front and be up front, and they need to be communicating with their guys, and they need to be reminding them, this is what you signed up to do. Although it be unconventional or a little bit unusual per se, but this is why we're here.
Well,
I think.
Go ahead.
This too. It is interesting that I do think this is probably going to be our career-defining public health disaster. It's the equivalent to the 1918 Spanish flu for our generation, probably. And I can not tell you how proud I am of the people and my colleagues, pre-hospital and hospital base, and how they responded. I also wanted to throw out one thing. This is probably going to surprise you greatly, but we did put a protocol in place to allow our medics to no-ride patients that do not need acute intervention or care, based upon a set of criteria that the paramedics used in their questioning evaluation of the patients, which is then verified by the EMS captain on scene, but allows us not to overwhelm our health system resources with patients that don't need to be transported.
Doc,
that was going to be my
Doc, hang on a second, Rick. Doc, define no ride.
So they are not transported by the medic if
Good.
They meet certain criteria.
Good.
And I was just going to ask that question, Dr. Coffman, because I was going to ask Terry. I don't know if you saw what the PD posted as to how they're adjusting, their responses. Where if it's not a burglary in progress, if cars in how you go online, and if it's an accident and without injury, they've kind of done that in the way of distancing, in a way of calls. And that was going to be my next question, because I know the hospital systems, you don't have to read, but a couple different places on the internet are being overwhelmed themselves. And I think that's an excellent move, Dr. Coffman, to do that. Terry, I know the PD's doing some things to kind of, if you will, ramp down what they're doing in the way of contact.
Well, sure. So we've absolutely put those measures in place, and as Chief Spinuzzi alluded to earlier, everything's changing. Chief McNeil and I are meeting. Basically, if I come in my office for 45 minutes, I go back out there and we meet. We meet with 6 feet of separation, of course, to stay within our protocol. But we shout at each other across the room of whatever the latest and greatest. I do want to say, and I think Dr. Coffman can allude to this, but we're a system here that if you want medical attention, we will accommodate you, and we have always been that way. But these are different times during this particular situation. So the fact that Dr. Coffman has allowed our highly trained people to go out there and make these decisions, and because ultimately what we have to preserve is this healthcare system. And I think everyone has heard the term in this business of flattening this curve, because ultimately we have to, and everyone is addressing this. If you look at the morning shows, you look at CNN, and everyone's heard the potential critical situation as far as ventilators and intensive care units and just critical space within our healthcare system. And ultimately that's what we have to do. And so, sure, let's use our guys to be able to make that decision. And if we can take a little bit of pressure off to allow that hospital staff and the hospital, the infrastructure within the hospital to address the most critical that day without exposing people to something they don't need to be exposed to, and then certainly draining resources where they're needed the most. And I think ultimately that's what we're all trying to do right now.
Well, I've been very careful about using the words "no ride" because that has a negative connotation for the firefighters as well as the citizens. I've been trying to stress that this is more of a patient diversion and allocation of resources. And I actually went on one of these calls the other day and was able to help guide the paramedics and the EMS captain and the patient and explain to them that your symptoms don't warrant a trip to the emergency room. They're not going to do the things that you want them to do. And she was an elderly lady who had no business being in the emergency room. So being able to have that conversation with her, instead of just going, you're not sick enough for us to take you, but having that conversation with the lady and saying, your condition would warrant, if you got the disease at the hospital, would make it worse, and helping her get to an alternative facility. And we were able to call her doctor and get her into the doctor's office where she needed to be seen anyways, without calling it a no ride. I called it more of a diversion.
That's really an important point, because the other piece of that is the education of the patient and the education of the family. We also, the medics provide that patient and family with information, CDC resources, home care guidance. So we're not just leaving them there. We're providing education and appropriate disposition for them in these current times.
So it's really treating in place and referring to the appropriate venue. So it's not just you don't qualify. It's, well, hey, we'll address what you're dealing with right now, and we'll direct you to where you may need to go or may not need to go. And I think that some of this stuff has really given, some of this event has really given a great deal of credibility to things like telemedicine, things like community-based paramedicine, because there's a lot that we can do for the folks who actually get this virus to even assist them going forward. And what struck me as really interesting recently is I was watching a newscast, and they were talking about several young people who started services where they're buying groceries for people who shouldn't going out and get themselves exposed and such like that. And it was interesting to me that for some of the news people, they'd never heard of people doing stuff like that before. Like, I guess they never read Viktor Frankl or Man's Search for Meaning, or like any of the Western classics that basically teach you that the most joy you find in life is doing things for others that can never repay you, with no expectation of ever being repaid. Duh. So it's the very essence of what draws men and women to the American Fire Service, is that we go out and we perform whatever we need to do, irrespective of the risks and rewards alike notwithstanding. To quote Thucydides, we go out and meet it, and we do it, as Terry pointed out, with a joyful heart. It makes us more alive. It makes us have meaning and purpose. And it doesn't mean we willy-nilly expose ourselves to potential death. And make no mistake about it, we now know that this disease does affect younger people. Now, obviously, as the senior member of this panel, and who qualifies in almost 5 out of the 6 categories that you can qualify for being at high risk for this disease: age, cancer treatment currently and 2 autoimmune diseases. I'm the poster boy for the guy who shouldn't go out. And I'm being cared for by my neighbors and friends and family, and I don't need it. I mean, if everybody's, I know there are half a dozen people here. If I needed to replenish my grandpa's Werther's Originals, they'll run out and get them for me. And so there's nothing too small that we can do to kind of dovetail on what the doc just said, what Doc Coffman just said, to help people get through this. The smallest act you're going to take in one of these no-ride situations is just going to be listening and saying, hey, right now we've kind of diagnosed your symptoms. Here's where you get the best treatment. Maybe it's a clinic, maybe it's your doctor's office, maybe it's just me here at home giving the doc a call and walking you through what to get. And so I think some of the stats that I saw, and Doc, you can correct me if I'm wrong, but out of South Korea, like 80 some odd % of the folks that were symptomatic that they tested turned out to be negative. So it was other diseases, other processes that mimic the symptomology, and the survival rate as we get bigger numbers is going to become bigger. We still know it's an incredibly lethal disease for folks who have got compromised immune systems, prior history with upper airway issues, smokers. We get that. Even kind of people with seizures, I heard, which was interesting. So we know there are very, very vulnerable populations. But the upside is that there's also some very resilient populations. And so as we get through all this, I think let me get this out of the way before we end so I don't forget to say it. Thank you, doctor, for taking the time. I know you've probably been working nonstop for the last few weeks, and I just can't thank you enough for being here, because I understand there's a huge sacrifice for you to carve out an hour for us to be with us. But
my pleasure.
Am I correct in those assumptions that?
So it is an interesting virus, and so I'll make 2 points. One is we're still in the flu season, so influenza is still in our communities. In fact, in the DFW area, we're around 14% of the swabs are still positive. What that means is that's probably around our peak. We're usually between 28 and 30% positive swabs. So we're on the tail end of it, but it's still very much prevalent in our communities. And so if you have a fever and you have body aches, you have headache, you have runny nose, you have cough, there's a really good chance that it's influenza. And right now we're tend to be type A. And that has changed over the course of this influenza season. So we had a really big flu season. The swabs hit around 32% positive, which means it was a pretty hefty flu season. Still having that. And then the other point I wanted to make is it's a unique virus. The coronavirus is unique in that it does seem to be targeting those most vulnerable. Limited in the pediatric age group, which is great. That's actually really good. Interesting, in the 1918, the Spanish flu actually targeted the middle group. So young, healthy adults, there's probably multifactorial, given that we're in the middle of a war in Europe. But it did seem to spare the young and the old and attack more of the middle. This virus seems to be attacking more of the older, with 80% really having reasonable symptoms and not progressing. Does that answer those questions?
It did, Doc. And you guys will all laugh at me for saying this, but quick historical note. I know. Okay, trigger the laugh here. Quick historical note. Had we been more correct in our phraseology back then, it would have been known as the Wichita flu, because patient 1 was actually identified through epidemiology to being an Army mess sergeant who was outside of Wichita, Kansas, at a deployment place, and then the military carried it across the globe. The reason it got the term the Spanish flu was Spain was not a participant in World War I. They were neutral, and so they reported their cases. Where when you're at war, you don't share anything. So Spain was reporting all these cases. So ergo, it got called the Spanish flu. But had we had better epidemiology back in the day, it would have been known as the Wichita flu. So sorry, I had to do that. Well, I know that's stupid and pointless, but sorry.
No. Well, but Dr. Coffman, we've said for years, and there's some great resources out there for our viewers today and those that watch us afterwards. My go-to has always been, the CDC at cdc.gov, and then the Area Association of Fire Chiefs, IAFC.org, has been awesome as well. CDC.gov and IAFC.org, especially CDC's got a great site.
I've been living on the CDC.gov site.
Well,
Literally.
and it's very user friendly, Doc. It's very, it's easy to. There's a nice flow to it, and they explain things very well. I guess let's shift gears here for a second with the panel, and with you, Dr. Coffman, first. We've said for years, that you need to keep your ambulances and all your medical equipment clean, and the whole bloodborne pathogen thing, and we've tried to make ambulances with non-permeable surfaces, and you get in and really clean stuff, and we've always warned young medics, young EMTs, look, if you don't keep this clean, if you don't keep your ambulance clean, if you don't whatever, you're just asking for trouble. We know that this stuff can survive on surfaces and that, but I guess I've been hit with a couple of questions already, off on the side here, for some viewers. Let's talk fire departments now. Let's talk exposure and quarantine or whatever. You heard, obviously you're well aware of it, being right there with Lewisville and the colony and what they're doing to reduce contact. But let's talk. Hey, because there's a lot of fire departments out there, Doc, that don't have the resources that maybe you do in the Metroplex, that are watching us going, okay, so we go on a call, we've done everything we can, and one of my guys or gals got exposed. What are we talking steps for them to take if they think or feel, or they've had a patient that tests positive? Because this is the big scary thing is, am I taking firehouses out of service, shifts out of service? What if it's my volunteer fire department? What are you seeing from your end, and what, as a medical director for Lewisville, what would you be telling them?
So this is a really critical point. And I'm glad you mentioned the CDC.gov earlier, because they do have a very nice grid that goes through low, medium, and high risk exposures. And it's very clear when you look at those grids. It changes whether based upon whether the patient was wearing a mask or not. And so the most important thing we can do is maintain distance and place a mask on the patient. As soon as you mask the patient with just a regular surgical mask, and you are then masked as well, even if you don't have full gown, gloves, and eye protection on, if the patient has a mask and you have a mask, unless you have to do some type of aerosolized producing procedure, you have lowered yourself to the lowest risk category. All right, and you would not need to be quarantined, regardless of whether the patient ultimately tests positive for COVID. That changes immediately if the patient is not masked. That's why it's so critical. Then, if the patient is masked and the provider is masked, the EMS personnel is masked, then it does get into what type of contact they had. Was there an aerosolized producing procedure? Did you have to intubate? Did you give a nebulizer? By the way, side note, unless you absolutely must give a nebulizer treatment, you think the patient's going to die if you don't give this nebulizer, don't give nebulizer treatments. All right. Absolutely minimize the amount of suction that you have to do. If you just limit those type of aerosolized producing procedures. I know not everybody does RSI anymore, but if you're going to intubate someone and you have the ability to intubate, you really should use RSI procedures if you have that in your arsenal.
Okay.
So back to what you were saying before. Side note.
Well, let's go. Great mess. Great point.
So then in terms of, I would walk through the exact exposure with the patient, the situation regarding the patient, what type of PPE the provider was wearing, the amount of interaction, engagement with the patient, distancing. All of that would help me determine low, medium, or high risk. Low risk, as I said, doesn't need to be quarantined. Medium would need to be quarantined for 14 days, pending the results of a test result on that patient. If the test turned up negative, you'd be able to stop the quarantine. If they tested positive, then you would need to continue the quarantine for the 14 days. That being said, hospital systems are already going to procedures where they would mask the provider and put them back to work as long as they're asymptomatic. We're already seeing that in places across the nation because the workforce is all, you can't quarantine everybody, right? At some point, you have to have people that'll work. And so if they're asymptomatic.
Quick question on that mask issue, because I work in a very rural area and we're already having some supply shortages. Other than masks, would something like a bandana help responders, or what? Because at some point, the question is going to become, we don't have enough masks. I know we're reusing our masks now in many of our smaller rural jobs. So, bandanas would, if we ask the patient to just maybe hold a towel cloth or a face cloth over their face while they're talking to us, are there any other kind of improvised solutions that you can suggest to us? I know it's not as good as a N95 or a surgical mask, but can you make any recommendations?
So an N95 currently is not required. So just make sure everybody knows that. A level 3 surgical mask is preferred, but you use what you have. If you don't have any then you do the best you can. But I got to be honest with you, gentlemen. We don't know enough about this virus yet for me to be able to say. And I would hate to tell you something that is just not accurate. So I just hate to make it. And if I had to, I would MacGyver it to death, right? But I just don't know how much protection that would actually provide.
Well, it goes back to just being proactive, and like we said before, keep everything clean. Wash your hands and do everything they've been telling you. Everything we should have been doing all along. That's why I brought up the whole, even pre this, about keeping your ambulances in your site after each call. It's easy to go through the motions and just wash your hands real quick. I've always been amused. Sometimes guys will glove up, they're in the back of the box of the patient, all this stuff. They'll get up in the cab, they'll drive to the hospital with those gloves on, and then they don't clean the steering wheel. And I'm like, you did all that and you brought all that from the back of the box to the front. It's just really, Doc, it's really just about being smart, being proactive. I'll just say this: overdoing it is not a bad thing. Washing
and
too
discipline.
many times. Yeah, discipline. There you go. Washing too much is not a bad thing. I've always been I travel a lot, and I'm not OCD, but I've always brought wipes. I clean whatever I'm going to touch. I clean the knobs and the doors. I where I put my phone, because I don't want to get sick, just even with a cold or whatever it is when I'm traveling. I think being a little bit more aggressive nowadays with what you're doing, especially through this, is not a bad thing. The social distancing, like you said, but if you have to do something, be smart about it. Be proactive. Wear whatever you can to protect yourself. It goes back to, Bobby, what you said initially. We signed, and Terry, we signed up for this, and Scott, you talked about it. It's I've said before in plenty of classes that God forbid we have another 9/11. However you want to call it, in that way, of that type of incident. When the dust is cleared and everybody else is running for the hills, you're going to see a handful of groups in the street. And that's going to be the men and women in our armed forces, law enforcement, EMS, and the fire service, because we took an oath. Bobby, you did a keynote on the difference between taking an oath and some of the other different careers out there. We stood up and said, we're going to step up and take care of this. So again, on the flip side, then let's not throw caution to the wind and just say, we haven't seen that many cases here or whatever, because just not being smart with this can get you some problems. So
I was having lunch with one of the smartest people I know, my wife, and I was kind of talking to her about some of the things that are going on and the anxiety that I'm having of planning ahead. And she kind of consoled me. She goes, I just read this yesterday, and I think you need to hear it. You'll never know if you over prepared, but you will always know if you under prepared. And that's where we are. And I know it seems like we're crazy, but if we can flatten this thing out, the better off we're going to be in the long run.
Well, every time we've prepared for the big one, the ice storm, the storms, or whatever, the hurricane, and we went, well, we did all that for nothing. Well, no, we didn't do it all for nothing. It just didn't hit us. We were prepared, because the worst thing is to stand there and go, especially for television cameras now, I don't know. We can't be the I don't know people. So, Scott?
Yes, sir.
I don't know if I thought maybe you had something.
No,
Scott. No. I was trying to jump in there. I was just going to ask Scott, because I think you've got a fairly young workforce. You've hired a lot of people. both on the EMS side and the fire side. So I guess in just shifting gears a little bit, what's uh, the fire station, the fire service looks drastically different today than it did 2 weeks ago. I can tell you that. And what's the, what have you had any communication with your guys? And I guess what are you doing when I say up front, out front, and you're limiting that social connection between stations and stations? But for me personally, and I know Chief Spinuzzi is, but I'm trying to get out there and stop in stations. I want to, I guess, just connect a little bit with guys and make sure they know that we're not all up here doing Google Hangouts and then pushing stuff down. That we do remember that they're out there and they're fighting a good fight.
Well, I mean, information obviously constant as often as we get it to them. But you said it. My big thing is I don't want us to lull into a complacency. We're not doing as many other activities, so we don't want everybody to get so wrapped up in getting their whoobies out and sitting in front of the TV and watching movies and forgetting what's there. So really that's it. We talk about mental, physical, mechanical, and procedural preparedness being the focus of every day, and that's especially true now. Now I'll tell you, usually I spend a ton of time in the firehouse, and I'm limiting a little bit how often I'm going. And one reason is I was in the Chicago airport Sunday. So I'm still, I don't know if maybe I'm coming down with this thing, but we're just trying to provide good information. We got some very good officers. We're talking with our battalion chiefs very regularly and having them go out. But I mean, everybody right now seems to be calm and collected. A side note, you talk about our young firefighters have a lot of young kids. So home isolation may not be a choice. The wives might say, hey, you got that at work, you're not coming home. So we're going to have to make arrangements to keep them here in town for that 14-day period. And that may be a little bit of a challenge. We're not there yet, but we're certainly preparing for it.
Well, that was where I was throwing that out there. And Bobby, you've been watching a lot of this, and obviously Dr. Coffman, but we've got a lot of firefighters across the country now, and I mean thousands of thousands. I'm just saying a lot of them that have been exposed and need to be quarantined. And it's like, okay, so where do we put them? How long do we, what do we do to get the firehouse back in service? You go in and clean it. All right. We talked about how long this stuff from hours to days can sit on different. So they're doing all the testing, right, from CDC site as to what they're doing testing wise for the, to make sure surfaces are clean. But that's a great point, Scott, because that's one of the questions was before. What do I, we're everybody's knocking on wood right now real loud, just going, okay, it isn't here. But God, if I've got to quarantine, if I've got to put someone's got like a new baby at home, or, again, Dr. Coffman talked about the fact that thank God it's not as affecting, but you don't know, and you don't want to bring something home, just like we talked about before. So go ahead, Bobby.
So a couple of things there as an old fire chief, and to dovetail on what Dr. Coffman said a moment ago, pay attention to the CDC guidelines. And if you come to a point where you're quarantining people who are asymptomatic because you believe they were exposed in extraordinary circumstances, if they're willing, you can put them back to work using precautions, masks and such, because they may not have contracted the virus. So that's if your staffing becomes compromised. And that may happen, right? And remember that we are mobilizing naval hospital ships now. Something like 5 million respirators are coming out of the military cache today. We've got all the FEMA regions are being deployed and stood up. Our responsibility, if we have to quarantine people, we'll quarantine them at home like everybody else. And if we need to quarantine, say, the homeless population, or say we get a population that needs those FEMA beds and things like that, that's what those assets are for. Overflow from hospitals that are going to need men and women like Dr. Coffman, who may have to do accelerated rounds, and we'll support those facilities through our USAR, DMAT, all those assets that are being set up today and being mobilized today. So I think that we're going to see a lot of common sense stuff come out. And Dr. Coffman alluded to it a little bit earlier. Just because you've been exposed doesn't mean that you've been acquired the the disease, right? And we understand, looking for symptoms and all that good stuff, but there may become a point where we become compromised for manpower, that we may need to do some innovative things like return people who are asymptomatic or have been tested. And as the testing becomes more available, hopefully it will be quicker. But some really simple things to do in the interim. Don't wear your station clothes home, period. Wash them at work or bag them and don't expose your family to them. If you go on a call with someone who you believe may have been ill, get another pair of station wear or bring an extra pair of station wear. Bring civilian clothes to wear home. Treat your call as if every call you were contaminated, like you would on any hazmat call while this thing's going on. And obviously, while you're on duty and responding, you're going to be in what you're in, right? If you run out of Tyvek and stuff, you're going to be in what you're in. But you don't have to take it home, and you don't have to contaminate areas of the station that you don't need to contaminate. So, hard times require hard men. And there's an old saying from the Bible that hard times create strong men create good times create weak men men create hard times, and hard times create strong men. And so we've got a lot of really strong men and women in this industry, and our brothers and sisters on the medical side and the law enforcement side and the military side, that we're going to be the leaders here in our communities. We have to act like it, emulate good practice. So, Doc, was I correct on that? That if we have an asymptomatic responder, that we can utilize them while we're waiting to find out their test results if necessary, and put them in the field if needed?
You can. The CDC guidance is if all other staffing solutions have been exhausted. And so today we're probably not there. Tomorrow or the next day, next week, maybe we will be. So what we've done is to try to make shift swaps, adjust that to fill in those gaps. But we will get to a point where we will have to make decisions like that.
And that's a great point. And, we've been talking about, it's so hard in an hour to cover everything. And I can't thank everybody enough for as crazy as it's going, especially Dr. Coffman. I know how crazy things are for you right now to spend an hour with us, because this show, Bobby can vouch for this, show reaches a lot of people, and they'll be playing this over and over again. We talked about the resources, cdc.gov, please, to our viewers. It's an incredible site, like Dr. Coffman said. If you're a chief officer, if an officer, go to the IAFC, International Association of Fire Chiefs.org, IAFC.org, their site. They did a great webinar, and they answer a lot of questions and concerns through that. Just watch it and see where things are going. And another thing I want to throw out there, Lexapol, our good friend Gordon Grandbobby, they put out a post this morning for those of us like my wife that work in law enforcement and that deal with prisons and jails. There's a great shot. Terry, I sent it to you. A great hour and 15-minute little thing they did on what some of our, think about it, the incarcerated folks, prisons, jails, all them, what they're dealing with and how they should be dealing with it. It's a great, great thing to watch. Again, fireengine.com, Gems is putting out some great stuff. Doc McAvoy, Mike McAvoy, Bobby's editor for Gems, is incredible. There's great resources out there, folks. Please take your time right now, especially with the downtime, if you will, to become a student of what's going on. Dr. Coffman, and we're going to go around the table here as we finish things out. And we always ask our speakers for some advice. And this, God, I couldn't think of a more important time for this. I know how much you truly love and care for the EMTs and paramedics that work for you, that you oversee. Like I said, you have a very special place in my heart. I was with you for 12 years, and we went through some good times, some bad times. And you want to talk about our show during times of crisis, it's always about leadership and discipline. You were always there for our people. I've never seen paramedics rally more around a medical director than they do you and their support. What advice would you give? We've got an audience all over the country watching this, all over North America, all over, in fact, beyond the United States and Canada and that. What advice would you give to our EMTs, our firefighters, our paramedics right now from your end as we work through this?
Well, I would say just one sentence. It would be disciplined and protect yourself, so that you stay safe and your family stays safe. We can't work through this disaster without all of you there. And so protecting yourself and being disciplined about those protections, there's nothing more important than that. There's nothing more important than your health and safety right now. And I would say finally, Galatians 5:13, in love, serve one another. And that's exactly what we're all doing. And I appreciate you very much.
That is perfect. Hang in there, Doc, with us for a second here. As well, for all our guests, when we go off the air, we'll stay on for one more minute. Chief Spinuzzi, Michael, from some advice. You're in the field. You're probably one of the most current, if you will, definitely on this panel. You're out there still doing it. You're active with your ambulances, with all your medics. What advice would you give to some of these other fire departments that are watching?
Be patient. Just be patient with the administrators. Be patient with the policies. You may not know everything. They're changing rapidly. So just be patient with us. And if I can quote my pastor from last weekend, best thing to do is trust God and wash your hands.
There you go. I like that. Chief, Michael, if someone, and I don't want to inundate you with stuff, but if somebody wanted to reach out to you, a smaller department that doesn't have the resources that Lewisville has, that doesn't have a Dr. Coffman or whatever, if they're just curious, what's an email address? If they want to just shoot you email, say, I need to talk to you for 5 minutes on the phone or whatever, good email for them to get a hold of you.
Easy address. It's M Spinuzzi, MSPINUZZI at cityoflewisville.com. All one word, Lewisville with an E.
Hopefully they won't be too bad. I know you're a good guy and you'd be willing to help.
Absolutely.
Lewisville's always been incredible with their help to the other folks in the fire and EMS services. Chief Thompson, you're again one of the leaders in the fire service arena.
Thanks, boss.
When it comes to the great bosses, it's evident with the respect and the following you have. From a chief side, what advice from the boss's seat?
Well, I agree with everything that's been said, but this is what I'm going to offer. Measure and track everything and get a local feeling. I mean, we're hearing what's going on nationally, but get a feel for what's going on in your jurisdiction. Look for trends, track your high risk people, and get a real good feeling for the area that you're responsible for. And I think that's going to help put things in perspective each day that goes by. And then the second thing I would say, man, don't let your guard down for a second. This is one of those where we got to stay vigilant. Like I say, that mental, physical, mechanical, procedural preparedness now is more important than ever. And just don't let your guard down. We'll get through this. And anything I can do to help, I'm certainly willing to do that. But those would be my two things.
Scott, what's your email, buddy?
It's sthompson@thecolonytx.gov. And that is a city in Texas. It's not a cult.
And I know that by heart, but because you've been on here so many times with us. Terry, before we get to Bobby, closing thoughts. And one of the things that what Scott said, stay on top of things, stay local. That means reaching out to your local health department and your state agencies, so on and so forth. But what is your county maybe doing or whatever? A lot of great resources are at your fingertips, right?
Well, absolutely, and we are. While I was on this show, the county just sent out a deal for 3:00 today for the Denton County Fire Chief. So we're communicating with one another. The two things I would probably pass on, and I reiterate, I think this is going to be a long road. Man, take care of yourself and each other. I told someone this morning, man, you got to laugh to keep from crying sometimes, and it's just. This is unprecedented times right now, and there's a lot of stress out there. And I think firefighters in this culture is the world's worst at dealing with it sometimes because we don't lean on one another as much as we should, and we need to. I say to the chief officers and the station captains out there, talk to your people, make them talk to you. Get around. You guys have some family time at your station. This is the worst time in the world to have those fire stations right now, that everybody can go to their individual bunks, turn on their TV, and sit there and watch CNN, and never get away from the horrific news and the stories and the numbers and the everything. But it's just the strength comes from us and from each other, your brothers and sisters, and remember, this is why we got into this, and take care of each other.
Chief, great point, Terry. Great point, Terry. Chief Halton, you've always been good at letting us run a few minutes long with these once in a while. I know we're a few minutes over, but this is a very important show and on a very important topic. Bobby, Chief Halton, closing thoughts from you, brother.
Yeah, stay connected. Obviously, if you're in the field, and all of us on this call are, so stay connected with your adjoining departments, with your crews. Stay busy, stay active. That's the key. I keep hearing about the downtime people are going to be having. If you've got the skill set that firefighters have, I don't see a lot of downtime in the near future. Lots of places need you, whether it's your volunteer job, maybe the local homeless shelters, the missions. Stay connected, stay busy. As Scott said, obviously the colony, I heard it's a little Republican ghetto outside of Dallas, may not have a lot of shelters, but if you live near a place that does, you'd be surprised at how many needy people there are right there in your own, no matter how affluent your community may be. There's always folks who can need us. Be a blessing to someone. Remain connected, stay strong, and take care of yourselves. That's the most important things you can do.
Outstanding. Well, guys, like I said, Bobby, you've always been gracious of letting us sometimes run a few minutes over with these rather than kill something else, because it's just great information. Great time. And I'll just say real quick, Dr. Coffman, Chief Spinuzzi, Chief Thompson, obviously Chief Halton is with us all the time with this, and Terry, my co-host. Thanks, guys, for coming on with us today. Doc, I love you. I love you. I love you.
Thanks, Chief.
Notice I didn't ask you for your email because you're the wrong person.
I noticed that.
Inundated with stuff right now.
I love you too.
That's the last thing you need right now. You've got enough on your plate. But hey, folks, we're all on Facebook and Twitter and the web. If you need to get a hold of us, shoot over to one of those sites. Terry, and our next show is April 15th. Fire engineering, we say this every time, always has some great hangouts here on Wednesdays at noon Central, 1 p.m. Eastern, with some great people, with some great resources. In closing, we always ask you to keep the men and women armed forces in your thoughts and prayers. We'd like to ask you to keep everyone right now in your thoughts and prayers. And remember, as a firefighter, a police officer, as an EMS